My name's Claire Wakefield and I'm from Sydney Children's Hospital and the University of New South Wales. So my research is about looking after childhood cancer survivors and their families, and in particular I guess it's a really exciting thing that heaps of children are now surviving cancer, more than 85%, but many of them are struggling with chronic health conditions because of the really intensive treatment they had on their developing organs. So I guess what we're doing is instituting a group of projects to really help survivors and their families to do better after treatment. So we have two mental health projects. Both of those are resilience programs for parents of young cancer survivors and also adolescents and young adults to help them to go back to normal after their cancer treatment finishes. This can be a really hard time for families after 2 years in the hospital to try and go back to their normal lives. The other projects that we have are more healthy lifestyle projects. So we have one looking at making sure that older cancer survivors do the screening that they need to make sure their cancer never comes back, and also to improve their healthy eating and exercise levels. And then we have a really important project for bereaved families, so parents and brothers and sisters who've lost a sibling to cancer, to make sure that that family survives even if the child didn't. Well, one of the unique things about our program, I guess, is that we really want to implement the things that we've developed. So we're not just a program that will, sit in a university and do lots and lots of research forever. So one of our key goals in the next 3 years is to implement the programs that we've proved are effective into the community. So we have particularly our two mental health programs are ready. One of them's ready right away to implement with our community partners to make sure that anyone in Australia can access the program, no matter what language they speak and no matter where they live. Without the community support, none of this would happen. So we thank, researchers thank the community generally from the bottom of our hearts to make sure that we can do things that actually make a difference to patient care in the future.